Good afternoon. I'm Sheila Hogan, and I'm the Director of the Department of Public Health and Human Services. Today, we are launching Parenting Montana, a new resource for anyone in a parenting role. A new resource that provides tools to address common challenges parents often face with their children. This project has been many years in the making, and there are so many people to thank, including many of my own staff. It was hard for me not to think about leaving the hospital some 25 years ago, hoping for an owner's manual when I left with my daughter, and nobody had an owner's manual. So I know firsthand that this is going to be a great resource for people. I want to thank Vicki Turner with the Prevention Resource Center, Christine Steele with Addictive and Mental Disorders Division, partnered in lockstep with Montana State University Center for Health and Safety Culture in making today's event possible. So what is Parenting Montana? Parenting Montana provides easy-to-use parenting tools in support of a child's success from kindergarten through teen years. The purpose of Parenting Montana is to strengthen emotional skills of parents and their children, which will contribute to a healthy and successful life. It includes a website located at parentingmontana.org and a statewide media campaign. We'll be looking at the new website in a few minutes. I've seen it twice, and every time I see it, it's more and more impressive. I've been given a sneak peek. I'm sure will find it tremendous. It's a tool that parents will be able to use as a child matures. Parenting Montana includes media resources such as videos to help promote this site. We'd like to now show you a 4-minute educational video.
Here in Montana, we want the same things for our kids. We want them to be confident, respectful, and make healthy choices. To grow these skills, I've been using tools and a process I learned from parentingmontana.org. The website has information for me about my child at every age for dealing with issues, like chores. The process provides me with a way to build the skills she needs to be successful.
I've been using them to engage my granddaughter as we create daily routines, like getting ready for school, taking care of her clothes, and going to bed on time. These used to be a challenge. Now she's more independent and growing a sense of responsibility.
I could have just told him that the more he practices, the more confident he'll get. But I saw a bigger opportunity here. I recognized that growing his confidence on the court could help him be more confident with school and his friends. At parentingmontana.org, I learned that most Montana parents agree that their kids are more likely to learn how to manage their own behaviors, solve problems, and make responsible decisions when we intentionally engage them. So I started by getting his input on his goals. We talked about what he wanted and what he was willing to do to have a better game. Together we have created a practice schedule, and I'm going to help him each night with his skills.
Because I use the process I learned on parentingmontana.org, I've improved my relationship and communication with my daughter. A strong, healthy relationship and good communication skills help us work through challenges like studying. For her, studying does not come easy, but I have worked on our relationship and ability to talk so I can help her succeed at school.
Parenting evolves as our children mature. The same process I used to help my son deal with stress can be used with my high school daughter to manage peer pressure about alcohol. We've had conversations about alcohol. I'm like most Montana parents and disapprove of high school students drinking. When I wanted to know more, parentingmontana.org gave me information to teach her about the dangers, the brain, and the law. And today was an opportunity for her to practice resisting peer pressure and for me to support her.
To prepare my child for after she graduates high school, I need to let her be in situations where she can practice healthy decision-making skills. We use the process to establish our family's expectations and rules about when she's out, including talking before she goes, checking in while she is gone, and filling us in when she gets home. Our conversations won't end when she graduates. They will change. Allowing her to practice making decisions now while I can support her will make her more successful when she leaves home.
Parenting is important to me. Figuring it out doesn't come easy. I'm always learning how to be the parent I want to be, like a better listener and more patient. ParentingMontana.org gives me a process and tools to raise my kids to be confident, respectful, and make healthy choices. I'm proud that we want these same things for our kids. In Montana, we have many things to be proud of, and it's the best place to live and raise a family. ParentingMontana.org, tools for your child's success.
Thank you. That is really nice. Next, I'd like to introduce Governor Bullock, and I'm sure he'll share some of his parenting adventures with us. Thank you.
Thanks, Sheila. Thank all of you for being here. And I guess I'd begin by echoing Sheila's comments and extending my thanks to those that worked so hard on this for more than just a week, for literally the last couple of years to make this project a reality. Because indeed, meaningful projects don't get done and don't happen overnight. When you look at the website and some of the tools, you can see firsthand just how much work did indeed go into this project. Directly addressing topics that Montana parents can use, such as building confidence, managing conflict and stress, dealing with peer pressure, and getting homework done. Because in the end, we all want and hope for the same thing for our kids. We want them to be confident, we want them to be respectful, we want them to be making healthy choices all through their lives. And to grow those skills, Parenting Montana has tools, provides information for our children at every age, from kindergarten through the teen years. Provides Montana parents with ways to really build the skills our kids need to be successful. And the tools and the topics that are addressed here are a direct result of what Montana parents told the folks working on this that they need through a parent survey, through focus groups, and through forums. But I also want to stress that this is indeed only the beginning. If there are topics on the website that are not covered, Montanans will have the opportunity to make suggestions, and more topics will be added later. We'll be adding tools specifically for grandparents, for foster parents, and for parent wellness. There's so much valuable information on the website, truly something for everyone, even with the most challenging parenting situations. Information's also free to download, share electronically. It's interesting, as Sheila was speaking about taking her daughter home from the hospital for the first time. And I even go beyond. Before that, my wife was the oldest of 6 kids, and I was the youngest of 2. So I remember even before our oldest was born, like saying, we gotta take, one of these parenting classes. And I'm a lawyer, so I scribbled notes all the way along, and I learned how to swaddle. And then, of course, when my daughter was born, I'd lost the notes. Whatever preparation I had done was already gone. And that was fundamentally the start of what's been a 16-year ride where, with our 3 children, 16, 14, and 12-year-old, that I'm not sure anything could have sufficiently equipped me for this challenge and for this gift that I have of being a parent. And I think that certainly the job that I get to hold each and every day can be both difficult and indeed unpredictable, but so can being a parent. And anything we can do to provide parents the skills and the resources and something to look at for what is also probably the most important job that any of us can have can only benefit us all. We all want to be the best parent possible, and I think it's safe to say that there are times when we all probably need a little bit of extra help. For example, let's even start with homework struggles. Some kids sail through school. They never have an issue. There's some who truly struggle, and it can become overwhelming. Parenting Montana can help. The website has information to show parents what is needed to get our kids' input in developing an approach to studying, figuring out the best time to get homework done, where they should work, and how to reduce common distractions. And knock on wood, I'm going to learn something from this, because even as any parent knows, kids approach it differently and sometimes with challenges. Tool shows parents how to create a homework routine as well as ways to support, celebrate their efforts. Another example is underage drinking. Extensive research shows that growing social and emotional skills of youth reduces underage drinking, substance use, other risky behaviors, and helps with suicide prevention. Strong social and emotional skills lead to better academic and workplace outcomes. Montana, like other states, has been focused on reducing underage drinking. Our efforts are certainly making a difference. Among high school students, it's been steadily decreasing over the past 25 years, as at the lowest level since 1993, when the surveys of students just began. However, current rates of underage drinking are still too high. And those stats can really hit people hard. That motor vehicle crashes, overdoses, and suicide account for 6 out of every 10 deaths of children and young adults between the ages of 5 and 25 in Montana. 6 out of every 10, and recognizing behind every statistic is a life lost and a life impacted even far beyond that one individual life. The misuse of alcohol is certainly a contributing factor to many of these deaths, and alcohol is among the most commonly used and abused substance among youth in Montana. But this is the key, that parents and those in a parenting role can actually reduce underage drinking, because it's parents that children listen to the most. Are you sure about that one? Sometimes, as my kids grow older, it seems like they may want to listen to me the least, but indeed, that's what, no matter what, the teenage brain might tell a parent, that it indeed still is really parents that children listen to the most. So whether it's dealing with underage drinking, or peer pressure, or bullying, or chores, and so much more, I'm excited about the work that's been done that we get to announce today, and what it provides for Montana parents starting today and into the future. So thank you for being here. Thank you for helping get the word out. But thank you also for the good work that will impact folks long beyond today's announcement. Thanks so much.
Thank you, Governor Bullock. I have to say, when they turn 25, they come back. They think you're smart again. So we had a speaker that was coming today, Brandy Tyree from Missoula, but really chose to stay home. We encouraged her to stay home with the weather. So she asked that I share her remarks, so I will do that. Brandy is one of the 35 local prevention coordinators who work tirelessly to engage local communities. Most of the work we do on prevention we contract with local communities, because they're the boots on the ground that they know their communities, and they're the best to provide services there. They work directly with parents and educators to help encourage youth into making healthy choices. Brandy states, "We live in a state with high underage substance abuse rates, and we know that parents are the #1 influence that can help reduce these high rates. Dedicated prevention specialists across the state of Montana have long envisioned a unified supportive message and tools that parents can use to assist bolstering protective factors in their children. Montana parents are doing their best to raise healthy and resilient families and deserve all the support and resources we can share. As a parent and prevention specialist, I am grateful to DPHHS and MSU and others across the state who have worked tirelessly to support parentingmontana.org, an invaluable and much-needed resource for parents, guardians, and those working with children and prevention specialists to reduce underage substance abuse in Montana. This tool will give consistent support to parents and give prevention specialists across the state a resource. Parenting Montana will be available to anyone who is in the role of raising children. We have been waiting for this collective tool, and I have much gratitude for the foresight of those who made it possible. Thank you, Brandy. Next, I would like to introduce Anna Marie McMahill, who will show us the website and provide some more detail.
Thank you. Great. So parentingmontana.org is a website for parents or those in a parenting role. There are readily accessible tools for parents for children ages 5 to 19 that you can view online or even from a cell phone. The tools address common challenges that Montana parents said they face, like friends or homework or routines for the younger ages, or conflict, mixed messages about alcohol, and establishing rules about alcohol and stress for the older ages. It'll take a couple minutes and we'll look at the stress tool. Perfect. So within each tool, parents will learn how now's the right time, that parents play an essential role in their child's success, and how we all face similar issues. Parents will also learn what can be gained in the short term and the long term by addressing the issue with their child. The tool is organized into an easy-to-use 5-step process that creates an environment for learning that allows parents and their children to practice and grow social and emotional skills. There is a place where you can download a brief summary of each of the 5 steps, something small that can be printed off and put on a refrigerator door. The tool also has many tips and traps along the way to guide parents as they are using the tool. And the tool gives parents the actions to take, and at times ideas of the words to say to engage their children, to build relationships and strengthen communication. At the very end of every tool, parents have the option to download it, to save it, or to email it. Additional information is found in a section called I Want to Know More. It covers topics like intentional communication, to learn how to communicate in a purposeful way with your child to support and enhance your relationship. Or healthy risk-taking, to learn how to support healthy risk-taking and help your child avoid taking unhealthy risks. Or why teens shouldn't drink alcohol. Gain insight into the consequences of alcohol use, reasons to delay, and specific strategies you can implement to avoid underage drinking. Back at the top of the website, there is a resources page. And the resources page has a connection to additional Montana resources that parents might find helpful, including connecting to those prevention specialists found in their area. There is also a page of key findings from a 2017 survey of Montana parents. The survey is able to, you can download the key findings report from this page. And then lastly, I will show the media page. So a vast amount of information can be found on the site, but also media, video, radio, print, social media, and articles that can be shared on social media, in newsletters, or in traditional channels like television, radio, and direct mail. All of the tools on the website can be viewed easily, downloaded, or shared electronically. And then beginning February 1st throughout the state, we'll have placed TV, radio, and web PSAs that highlight the value that Montana parents want what's best for their kids. A second video, a component to this video, is featured at the top. And then there are 7 main characters to the story that you watched earlier. And those 7 main characters, their story unfolds in the subsequent videos that follow. Lastly, on the right-hand side, there's a section called Not Seeing Your Issue. And so parents can request additional tools that they would like to see developed. And those will go into consideration as future development occurs for the project. That's it. Thank you.
Thank you, everyone. Thanks for coming, and thanks to Montana State University for being such a good partner. Thank you.
is there evidence that this approach or this kind of approach is effective, and how are you going to know, what are your metrics for whether this is effective in terms of use of state money?
So I will ask Montana State University as the scientists that will talk about evidence-based programming.
So, great question. There is extensive evidence around improving social emotional skills and reducing risky behaviors among individuals, really at all ages, youth to adults. There's extensive evidence about ways of growing social emotional skills with children. Most of that research has been done in the school environment, but some has been done outside of that environment. And there's more and more research that's ongoing to look at the roles of encouraging parents and working with parents so that they can work with their children to grow those skills. There are not tools like this out there. This is really the first of its kind. So there is not extensive evidence of this very tool. And that's part of what we will continue to do research over the years. We really view this launch as building a platform that we can build on over the years. And so we'll do additional research there. But from a research standpoint, there's just tremendous evidence about the benefits of growing social emotional skills with kids.
Can you give me maybe like one or two examples of the metrics to be tracking to know whether this approach is successful?
Good. So on the first hand, what we'll do is track through the prevention specialists and the coordinators. The first thing we want to do is see, are they able to use the resources that we've created for them to help connect parents to the site? So is it getting out even to reaching parents? We'll then track through the website how many parents are engaging and what tools and how long they're looking at those different tools. And then the next phase is that we will be seeking to wrap more research on a more intensive level to look at maybe subgroups of parents to see how do they use the tools and how do those tools then start to reflect into behaviors with their children. Long term, we look at outcomes with children in terms of seeing reduced risky behaviors. But that's really something that's years away because when you look at a developmental approach like this, it's going to take years for those kids to go through it and then get into those ages. But those are all big things that we'll be monitoring as we move forward.
And when can we expect to get some data on whether the things you're measuring are proving out?
So I think we will be monitoring data in terms of engagement with the site on a regular basis. So I think we would start reporting on that in the next 6 months to a year. And then the research more intensively engaging with parents is something that will unfold over the next 2 to 3 years.
Thank you.
And it might be, Vicki, is the prevention dollars, is that federal monies, is that, or Sheila or Vicki might be good to answer that.
So we use the Prevention Block Grant to fund this program. And we talked about earlier surveying parents around Montana. So this was developed as a resource to answer those questions.
But the Prevention Block Grant is a federal dollars.
The Prevention Block Grant is a federal program.
Just really quickly, a quick question. The characters that you guys talk about here, are those actors or real Montanans?
There's a mixture of Montanans and actors.
And what chose you to focus on these specific topics, if you will, or diverse childhood experiences, that kind of stuff? What made those topics the ones that you wanted to focus on first?
We asked parents. I had mentioned a survey. So parents responded on what they would like to see. This is a resource. We addressed their comments with resources to deal with situations that arise.
I was wondering, is the site monitored like 24/7? Is there a person who's sort of monitoring comments, or if somebody reaches out and says they're in desperate need of help or anything like that?
So in the current implementation, the site is not interactive like that. So that's where we do have connections back to the resource pages that if somebody's in a crisis, we connect them with those existing Montana resources to address crisis. So it's not a tool for crisis.
Well, is there any kind of number, any kind of metrics that you would use to determine if it's if it's a success or not, or is it the kind of thing where if it's one person who needs it, it's worth it?
No, I think from a prevention standpoint and sort of a public health standpoint, we want to be in a position where we're starting to reach a significant number of parents. When you look at parent training, this is something we can compare and look through the demographics of how are current programs reaching parents. So those numbers are collected, and those are things that we can compare within the state as well as other states. Typically, direct service programs with parents are very tricky because it's hard to find parents who are able to come to those. Sometimes they're mandated by courts, but on a volunteer basis, it's hard to find the time. So bringing resources to parents has always been a challenge in prevention. So we'll be able to look at sort of how many unique folks are visiting the site and be able to compare that to other resources to reach parents. And I would say if we're getting at the level of where we're reaching 10 to 15% of the parents with a tool, that's vastly higher than any direct service that's occurring.
I'm sorry, sir, I did not get your name.
Oh, sorry. Yeah, my name is Jay Otto, and I'm a researcher with the Center for Health and Safety Culture.
J-A-Y?
J-A-Y-O-T-T-O.
Researcher?
Research scientist with the Center for Health and Safety Culture. Same place as Anne Marie.
Thank you.
Sure.
Just to follow up, sir, you mentioned courts potentially being a factor on this. Is your administration, maybe this is for the governor, going to be working with the court system with this tool?
From our design standpoint, and those folks can come in more, it was not originally designed as a referral tool from courts, but it's certainly something that courts could connect with, and certainly those folks who work with courts and those individuals who are providing direct service to parents can leverage that. So basically anybody who's working with parents can just jump on, download some of those tools, and use those as a framework to work with parents and hopefully help them. And that could be through a court-ordered situation or a teacher who's working with a family to help a child do better at reading. We hope they can just download a tool and use that as a discussion guide with the family.
For Montanans who might be skeptical of advice from the government, what would you say to them to convince them that the tools and the advice being offered here is good advice, effective advice?
Good. So I think that's a great question, and I think it's an extremely important question. And I think what was fascinating for us is we asked parents on an open-ended question, what 3 skills do you want to grow? What 3 skills do you think children need to be successful? And we did not make, it was not a multiple choice question. It was an open box where they could write in anything they wanted. And we received over 500 different skills identified from that. And then we examined and coded those skills. And 90% of those skills were social and emotional skills. So this is something that parents intuitively see. I want my kid to have confidence. I want my kid to have a good work ethic. I want my kid to be respectful. The tools are very much around a process. So when you look at the tool, it's not saying you should do X, Y, Z, and that's going to make your child respectful. It's more, here's guidance that you can think about, and the parent's going to make it their own. They're going to do it in their own voice. They're going to do it in their own way. And so the content is very much, or the content of the website is really focusing on a process and steps, not specific content, not like, here's the exact message to say. And I think that's where a parent can see, yeah, this really makes sense. And with any public health effort, you're going to find folks who, this doesn't work for me, and that's perfectly acceptable. But I think when you start looking at the content, you see it has a different flavor to it, where it's something that an individual parent can make their own.
But the processes and steps, those are based on like social science research or best practices or someplace. Where did you get the foundation?
Right, so those come back to sort of grounding in social and emotional development, which has been strongly studied. It's studied not just in the United States, but in countries around the world, and there have been studies looking at it in multiple cultures, even within the United States, multiple cultures, and recognizing those core elements of social and emotional development are very similar across cultures. And so, you know, the words you're going to use is going to depend on the culture, but the process tends to be very similar.
Thank you.
We have time for one more question. Anyone?
Well, thank you very much.
Thank you.
Perfect, thank you.
Good job.
Thank you so much.